if you both could say and spell your first and last names and your roles with AMR.
Sure. Randy Lauer, R-A-N-D-Y-L-A-U-E-R. I'm the Vice President of Operations.
Okay.
And I'm Robert McDonald, M-C, capital D-O-N-A-L-D, and I'm the Operations Manager at AMR.
Okay. From Multnomah County,
Yes,
correct? Okay. So what was both of your reaction when you first heard that this fine was coming for $513,650 from Multnomah County?
Well, my first reaction was, well, first of all, we learned of it through the media. The county didn't notify us directly. We got the notification after the chair did a press conference and announced it, which we didn't think was necessarily the best way to do. But what we mean is, we knew that if the fine could be applied, they'd calculated it prior, and we knew it could be applied. We thought it'd be the last thing they would do because it's the worst thing they could do at this point. $500,000 for 1 month of non-compliance, just a 1 month, is going to cause us to look at other things we do that are not within the bounds of our contract, but do provide good services to our community and our partners. Examples are the River Safety Program at the Sandy River in Troutdale, which we staff from Memorial Day to Labor Day, and save a lot of lives, prevent a lot of drownings. But that is a significant expense that we bear entirely. There's no reimbursement for it. Mm-hmm. Another couple areas that we do secure transports. Rob has gotten all of our ambulances through the state authorized to be secure medical transport vehicles, which means if police or someone else puts a hold on somebody that's going through a mental health or other crisis, we can maintain that hold and transfer the hold with the patient to the hospital, which frees up the police from riding along in the ambulance, staying at the hospital, and consuming a lot of law enforcement time. Similarly, with blood draws, if they have an arrest and they need to draw blood, we will go draw the blood for them, which saves the officer. They told us when we first started this, the city of Portland, up to a full shift can be committed to something like that. So it freed up a lot of law enforcement time. If we have to stop doing that, it's going to have serious ramifications. Mm-hmm. And that's what we don't want to do.
Yeah.
That's what this fine could potentially do. It won't do anything good. It could do a lot of things that are bad. Mm-hmm. It's not going to produce any more paramedics. There are just not enough paramedics out there. Not enough licensed paramedics in Oregon, or not enough paramedics in the United States. We're going through the most severe paramedic shortage our nation has ever seen. And for some reason, Multnomah County can't realize it. It's part of the solution here locally.
Mm-hmm. And Rob, let's talk a little bit about that. You know, is it fair that Multnomah County is putting this blame on you all?
Absolutely not. Absolutely not. In fact, it's been misleading really from the start. We've come to the medical program director, Multnomah County EMS, and then subsequently the county chair with a very good argument, supported by data, supported by history in EMS. We're having an argument right now in 2023 that was actually occurring across the country 10, 15, maybe even 20 years ago. They'd already determined that paramedic EMT was a more efficient EMS model across the country. So what we are doing right now is we're debating over an EMS system that is profoundly antiquated.
Mm-hmm. Yeah, and put that in perspective a little bit, just so people understand, you know, how many jurisdictions AMR serves nationwide, mm-hmm. and how Multnomah County stands out.
Yeah, it's interesting that you asked that, because of the 267 operations across the country that have 911 frontline responsibility, there's only one that has a 2 paramedic requirement, and it's here in Portland.
Mm-hmm. And do you want to add anything to that?
I was just going to say what Rob said. Nationally, the standard is the paramedic and an EMT. Counties surrounding Multnomah, Washington County, Clackamas County, Clark County, all paramedic EMT. The 2 paramedic model was developed in the 1980s. Everyone else has adapted and moved on and made their systems more efficient. Multnomah County is stuck in the 1980s. And it's probably because we've had a medical director since the 1980s who believed that, and he stuck with that belief. But we've got to figure out how to get the county to understand that converting to a temporary medic EMT system, where about half of our ambulance would be staffed with the paramedic and EMT, The other half would still be 2 paramedics. Doing that conversion is the only solution available. And if they don't act, and they don't act quickly, this is going to get worse. In September, in Multnomah County, we're 50 paramedics short. Now we're 55. By the first of the year, we'll probably be 60 short. And that's what the path and trajectory looks like. We're going to continue to lose more paramedics. And the reason behind that is this paramedic schools closed for 2 years during the pandemic. They're just starting to graduate students. But even after someone graduates paramedic school, it takes a considerable amount of field training to get them ready to actually work on an ambulance. The other thing is that with the civil unrest and the pandemic that occurred in Portland, it's less an attractive place to work. And so we're having a hard time recruiting paramedics to Multnomah County. In fact, we're losing paramedics who are going to a different field. They're going to the fire service, or they're retiring. 75% of the paramedics in Oregon work for the fire service. Another 5% work for tribal or nonprofit or hospital-based providers. Of the 20% left, AMR employs over half of those paramedics. But other areas that need paramedics, all the coastal counties, Jackson County, Southern Oregon, all those areas need paramedics too. So if we were able to recruit them all to Multnomah County, which we almost have to recruit them all from all those other providers, then those systems would fail. So that's not a good solution.
So the ones who have left, are they just wanting to leave Multnomah County and find work elsewhere? Is that really what it comes down to?
Yeah, they're being burned out. The fatigue is incredible. We're still running the same number of calls. We run 120,000 calls a year. This year, we're running 8,000 more overdose calls than we did last year. So the workload and the interaction with patients, where our crews are interacting more with mentally ill and addicted people who can become violent. Just that threat, that risk is causing a lot of people to go to a different county. Rob has 12 Multnomah paramedics who want to transfer to Washington County, but we've not let them because we're not robbing Peter to pay Paul. We're not going to take people from one county to the other. Each county needs to stand alone. But Washington County, we got notification they're going to unionize. So when they become part of a union, have rights to transfer within the bargaining unit, we won't be able to say no to those 12 paramedics. So we think there's going to be an exodus from people getting burned out and retiring. Just talked to a paramedic yesterday who's finishing up his nursing degree, and in December he's going to leave. So that's kind of the dynamic what's happening. People are fleeing the system. And until we get this under control, until we can manage to an effective workload where they're not getting burned out, we're going to continue to see that.
Yeah.
That's what I think is interesting and really confounding for us, is that we've done the analysis both with and outside of Multnomah County EMS. And it's so obvious there's only one pathway forward, and it's to incorporate EMTs into our system on a temporary basis.
Yeah. And I think it's important to, so this pilot program started when, again? It was May.
It was May, yeah.
Of this year,
Yep.
the 2 EMTs for low acuity
Right.
calls. So prior to that, there were no EMTs in Multnomah County.
No.
Only paramedics.
Correct.
And that, given just the time period that we're in, just having paramedics, it really put a strain on the system.
Profound strain, and really it has everything to do with the disproportionate impact of only utilizing paramedics as frontline ALS EMS servers.
So would you both say that Multnomah County brought this problem onto itself?
Well, they didn't cause it. They didn't cause the pandemic. And really the pandemic is what set this all up. So they didn't bring it on. They're not taking the correct actions to resolve it. That's the problem right now. The county is dealing with a lot of very complicated issues with substance abuse, with mental illness, with addiction, with unhoused people. They're dealing with very complicated issues, and I empathize with the county and the county chair with those struggles and challenges. This issue is not complicated. This can be solved right away. If today the county says you can staff with a medic and an EMT, tomorrow we could have 4 to 6 more ambulances in the field. And within 90 days we'll be fully deployed to 50 shifts a day. That's what we need to get to. Right now, we're only fielding 32 shifts a day. So that's the pathway to a complete solution, recover to pre-pandemic levels where we consistently met all the standards, including response time standards.
Yeah. What would you both say to paramedics here in Multnomah County, or people who are studying to be a paramedic and they want to work in the Portland metro area? What would you both say to them if they have doubts about working in Multnomah County?
Those questions are actually asked a lot from people, prospective employees and current employees. Like, when this is going to come to an end? When this is going to be fixed? When this is going to be solved? And what we say to them is, we're working as hard as we can to get the solution implemented. Please just be patient. Be patient a little while longer. You think about COVID, and they had to be fully in protective gear all the time, and they're exposed to patients with a real scary virus. So that by itself causes stress and fatigue. And then with the civil unrest, the 100 nights of protest in Portland, and the additional 8,000 overdose calls, additional behavioral health, mental health calls, our answer to them is that the system will recover from this if people make the right decisions. And that's what we're advocating strongly for, to convince the county this is the decision that needs to be made to allow paramedic EMT staffing. And absent that, the paramedic questions are going to continue like that. Is this going to come to an end? I can't wait much longer. I can't stand this much longer. That's the sentiment we're getting from them. They're very dedicated. They love taking care of patients, but they're more afraid for their own health, their own safety, than they have been in the 42 years I've been here.
Yeah. And Rob, what would you say to some of your employees?
Similar. One thing we're really trying hard to do is to support and empathize as best we can. We're doing everything we can to put as many ambulances on the road every day, to include very expensive wage incentives. And that does work to some degree, but there is a point where a person just can't do the work consistently anymore for their own health, and they just can't regardless. Those incentives, they might have to go away if we're getting these fines, and that's just going to make staffing that much harder for us. The fine itself acts as just another barrier for us to salvage the EMS system. And at the end of the day, when all this is done, we're going to be proven correct. Whether it be they've adopted our proposal and we've gone through and we've incorporated EMTs in the system and we've saved it, or they don't. And the paramedic crisis continues, and this EMS system continues to decline and fracture.
Are you both confident that the fine will be used effectively by the county? They've floated some ideas, but there's nothing concrete on what they're going to use this for yet, and it's a lot of money. So what are you confident it will be used effectively?
We have no idea what they intend to use it for. My assumption goes into their general fund. We fund the EMS office, Emergency Medical Service office, 100% of the budget we fund. We pay Multnomah County $2 million a year to be regulated, for having them oversee the contract. The fines are supposed to go into some sort of a system enhancement fund, but those funds that have been out there from the smaller level of fines that have occurred over the course of the last 28 years are relatively small, and they've all largely gone to benefit the fire department. None of that money's come back to AMR. And what would you spend, if you were the county chair, what would you spend the $500,000 on if your goal is to produce more paramedics? You can't just create them.
Yeah.
I think a lot of that has been really misleading too, because statements have been made that we have our own school, and yes, we do. We have our own paramedic school. It's a paramedic school that doesn't serve just AMR. It serves all of the agencies in the state, to include our fire agency partners, our hospital partners. So it isn't just an AMR only school. That said, only recently have those schools begun to even start to fill up. And much of that matriculation of students is as a result of our aggressive scholarships to EMTs in an effort to get more and more paramedics in. But the math is the math. There are not enough paramedics in the state of Oregon that are certified that can do the work. And even if we decide to aggressively go after all paramedics in the state, all we're really going to do is take our pain and spread that around through the corners of Oregon.
And we have done that. I mean, our recruiting has included that, reaching out to every licensed paramedic in the state. We've hired some people from that, but we've reached kind of that stasis level, I think, where people are where they are, and that's where they want to stay.
Yeah.
We're even reaching out to Kansas paramedics because Oregon and Kansas are the two states in the country that have an associate's degree requirement to be a paramedic. So we're reaching out to people in Kansas who are licensed there to come work to Oregon. Because the Northwest and Oregon is still an attractive place to come. Some of the buzz around all the civil unrest and things, I think, is starting to subside. People are less concerned about that than they are other things at this point. But recruiting efforts have been very profound. We've spent a lot of money and a lot of energy on recruiting every paramedic we can potentially find. The paramedic school that we have, both of the classes that are coming up here, one starting next month, I think, are full. We filled them up largely with EMTs. We're sponsoring paramedic school under full ride scholarships. So that's $18,000 per scholarship. And we've probably got in these classes a little over 30 EMTs. So that's a lot of money we're spending to get more staff as fast as we can. In Washington County, where we took over service August 1st, we hired most of the former providers' paramedics, but we had to pay that provider $250,000 to purchase the employment agreements that were still in effect. So we're spending an awful lot of money to recruit and to bring people on board. A $500,000 fine gives us $500,000 less to spend that money on.
Got it.
That was one thing that, through the course of all of this, we've noted the concern that we've robbed Multnomah County resources or any other operations resources to stand up Washington County. That is not true, categorically untrue. In fact, we're blocking medics from transferring to Washington County right now. We believe strongly that each operation has to stand alone on its own.
All right. Thank you both for your time.
Sure.
Appreciate your perspective.
Thank you.
You bet. Thank you.
All right.
One thing we didn't get an opportunity to mention on camera, but I think it's important to note, is we're at the point now with having met with city and county officials, but not only that, our fire department partners, our hospital partners, our city emergency managers, our state medical program director. And we're essentially trying to get a litmus test. Are we seeing something that, are we not seeing what's going on? And what we're getting is the entire EMS community, both locally and throughout the state, is shaking their heads.
They want to change.
They want this change, and they don't understand why. And unfortunately, Dr. Ju just hasn't really provided us any concrete data as to